So moving on to case 3. So this case is a 51-year-old patient who had been recalled from a screening mammogram for a suspicious right breast finding. So if we just pause for a moment and look at these 2D screening mammogram images, we have a power look assessment of category C. So this is back to that dense or heterogeneously dense category. On these 2D images, nothing really jumps out as being focal or suspicious. So this was a tomosynthesis only finding. So if we go to the next slide, we can see the image on the left with the blue arrow is showing a very subtle area of architectural distortion in the outer central breast, essentially just showing a very subtle change in the contour of that aspect of the breast tissue. So it was really hard to see as you're scrolling through the tomosynthesis images, but made much more conspicuous by the identification of profound AI, which astutely detected that finding with a high level of suspicion. So on the next slide, what I'm showing, these are MLO images from the current study, which is on the left side. So we have the blue arrow just showing that subtle area of architectural distortion in the central mid-right breast. And then the CAD, the middle image here is showing us the CAD representation where we had profound AI detecting that suspicious architectural distortion, thus making it much more conspicuous. And then the image from the right, this is kind of similar to the case that I had shown prior, where this patient had a screening mammogram. She had actually skipped a couple of years. So this one was from 2 years prior, but on a screening tomosynthesis from 2 years prior, the exam was read as negative. However, in retrospect, when we look at the profound AI had detected that finding 2 years prior. So again, I like to show these ultrasound correlates just to show kind of the sonographic appearances of these varying presentations of subtle cancers. So here we have the sonographic appearance of this mass, which was an irregular hypoechoic mass at the 8 o'clock position close to the nipple, about a centimeter in size. And then on the next image here, we have a biopsy clip showing that the biopsy clip does nicely correspond to the area of distortion, and it's in the exact location of that suspicious detection from the profound AI. And this one, it's interesting to point out that this one had invasive mammary carcinoma with predominantly lobular features. So we know that invasive lobular cancers are notorious in being difficult to detect just because of their infiltrative growth pattern. So what have we learned from this case in particular? As I mentioned, this is an invasive lobular cancer, so these can be really hard to detect. I think these are some of the ones that the radiologists do fear the most because they can be so infiltrative and so difficult to visualize until they reach a certain extent on the mammogram. So this is a case where the screening had been interpreted as negative in 2021. In retrospect, the cancer may have been faintly visible, but profound AI had made a detection for that suspicious finding several years prior. So just another illustration and example of a case that we potentially could have picked up sooner had we paid more attention to that profound AI.